Princess Diana was visiting a London hospital when she witnessed something in the emergency room that made her realize the healthcare system was failing its most vulnerable. An 81-year-old man had been waiting 12 hours with chest pain, repeatedly dismissed by staff who treated his complaints as exaggeration. Everyone in that waiting room watched him suffer and said nothing. Then Diana walked over, sat beside him, and asked the question that changed everything. "How long have you been waiting?" What she discovered about how the NHS treated elderly patients would shock the nation. June 1996, Diana had an appointment with her physician at St. Mary's Hospital in Paddington. Inspector Philip Bright accompanied her, maintaining his usual discreet distance as they moved through the corridors. They passed through the emergency department on the way to the private wing. Diana always felt uncomfortable with the separation, the gleaming private rooms upstairs versus the overcrowded chaos of the public emergency department. She slowed her pace, looking through the glass doors at the waiting room packed with people. An elderly man sat slumped in a plastic chair, one hand pressed against his chest, the other gripping a walking stick. His face was gray, sheened with sweat despite the air conditioning. He'd been there when Diana first passed through an hour ago. He was still there now. Diana changed in direction, pushing through the doors into the waiting room. Wright followed, concerned. "Your Royal Highness, your appointment?" "Can wait," Diana said, walking toward the elderly man. She sat in the empty chair beside him. Up close, she could see he was breathing shallowly, fighting pain with each inhale. "Hello," Diana said gently. "Are you all right?" The man looked at her, confusion and recognition fighting across his features. I'm sorry, I must be... The pain." "I'm Diana. What's your name?" George Fletcher." He pressed harder against his chest. "I don't mean to bother you, Your Royal Highness. I'm sure they'll see me soon." "How long have you been waiting?" George checked his watch with shaking hands. "Since 7:30 this morning. He squinted at the numbers. 7:20 now, evening. 12 hours. Diana felt her chest tighten. "Have they checked on you at all?" "A nurse took my details when I arrived. Said someone would see me. I've asked a few times, but they keep saying there are more urgent cases." "What brought you here?" "Chest pain. Started last night, got worse this morning. My daughter said I should come in just to be safe." George's breathing hitched. "But I'm probably just..." "They're right. Probably just indigestion. I'm old, everything hurts. Don't want to waste their time." Diana looked around the emergency department. It was busy, yes, but not overwhelmed. She counted 5 medical staff visible, 3 nurses at the desk, 2 doctors consulting near the treatment. Rooms. None of them were looking at George. A middle-aged woman with a crying toddler was called back immediately. A young man with what looked like a sports injury went through moments later. George sat, graying and sweating, invisible. Diana stood and walked to the nurse's station. A nurse in her late 20s looked up, Julia Sanders according to her name badge. "Excuse me, the man over there, George Fletcher, he's been waiting 12 hours with chest pain. When will he be seen?" Julia glanced at her computer screen. "Mr. Fletcher?" "Yes, he's been triaged. He'll be called when we have capacity. He's showing signs of cardiac distress. Shouldn't chest pain be a priority? With respect, Your Royal Highness, elderly patients often present with non-specific complaints. He was assessed on arrival and deemed non-urgent." 12 hours ago. Has anyone reassessed him since?" Julia's expression tightened. "We're very busy. We have to prioritize based on clinical need." He's clutching his chest and can barely breathe. "How is that not clinical need?" A doctor approached, mid-30s, confident bearing, expensive watch visible under his scrubs. Dr. Michael Reynolds, according to his ID. "Your Royal Highness, is there a problem?" "This man has been waiting 12 hours with chest pain and no one has examined him." Reynolds pulled up George's file on the computer. "Mr. Fletcher, 81, presenting with chest discomfort. He was assessed by triage and found to have stable vital signs, no acute distress indicators. He's in the queue." He's gray and sweating and in obvious pain. Elderly patients often exaggerate symptoms. It's very common. What seems alarming is usually chronic conditions they've learned to live with. Diana felt her anger rising. So your policy is to assume elderly patients are lying? Not lying, exaggerating. They get anxious, they catastrophize minor discomfort. We have to allocate resources where they're genuinely needed. He's been here 12 hours. How long would a younger patient wait with the same symptoms? Reynolds bristled. Age isn't a factor in our assessments. Then why hasn't he been seen? Because clinically, based on his presentation and vital signs 12 hours ago, he wasn't a priority. 12 hours ago, Diana emphasized, and no one has checked since. We monitor all waiting patients from across the room. How would you know if his condition changed? Other people in the waiting room were watching now. Diana was aware of creating a scene, but she was also aware that George had been sitting there suffering for 12 hours, while staff made assumptions about elderly patients, exaggerating. She turned to Julia. I want him examined, now. Your Royal Highness, with respect, we have protocols. Then I want to speak to whoever created protocols that leave an 81-year-old man with chest pain sitting untreated for 12 hours. Reynolds' jaw tightened. I'll examine him. But I'm telling you now, it's going to be indigestion or anxiety or a chronic condition he already knows about. He walked over to George with visible reluctance, Diana following. He barely looked at the man before pulling out a stethoscope. Mr. Fletcher, let's have a listen, shall we? George tried to sit up straighter, wincing. Sorry to be trouble. Reynolds placed the stethoscope against George's chest, listening for maybe 10 seconds. Breathing's a bit shallow, but... George's eyes widened. His hand flew to his chest, clutching. His mouth opened, but no sound came out. George? Diana dropped to her knees beside him. Reynolds was suddenly all attention, professional mask cracking. Mr. Fletcher? Mr. Fletcher? George slumped forward. Reynolds caught him, easing him to the floor. Code blue. I need a crash cart here now. The emergency room exploded into motion. Nurses ran over, equipment appeared. Reynolds was doing chest compressions while shouting orders. Diana was pushed back by staff, watching as they fought to save a man who'd been sitting untreated for 12 hours. Inspector Wright appeared at her side. Ma'am, we should move back. No, Diana said quietly, watching the scene. I'm not leaving him. After what felt like hours but was probably minutes, they stabilized George enough to rush him into a treatment room. Diana sat back in the plastic chair George had occupied, feeling the residual warmth of where he'd been waiting all day. Julia approached, looking shaken. Your Royal Highness, He's stable. They're taking him for emergency procedures. It was a heart attack. I know, Diana said. I could see it. Why couldn't you? We see hundreds of patients. We have to make judgment calls. And your judgment was that an 81-year-old man with chest pain was probably exaggerating? Julia looked at the floor. Elderly patients do sometimes. They present with vague symptoms that are hard to assess. So you don't assess them. You just assume they're wasting your time. Reynolds appeared, still in his emergency response mode, adrenaline clearly still pumping. He's going to surgery. We caught it in time, but... He trailed off. But if I hadn't been here, he'd still be sitting in that chair, Diana finished. How long before someone would have checked on him? Reynolds had no answer. How many others? Diana asked. How many other elderly patients are sitting in emergency rooms right now, being dismissed because staff assume they're exaggerating? That's exactly what you do. I watched it happen. You made assumptions based on his age, not his symptoms. Margaret Foster, the hospital administrator, appeared with the harried expression of someone who'd just been told Princess Diana was confronting her emergency department staff. Your Royal Highness, I understand there's been an incident. There's been systematic negligence, Diana corrected. This man waited 12 hours with cardiac symptoms because your staff dismissed him as an exaggerating elderly patient. I'm sure there were extenuating circumstances. There were. The extenuating circumstance is ageism. Your staff sees an elderly patient and assumes they're wasting resources. How many people have died because of that assumption? Margaret paled. That's a serious accusation. Yes, it is. Diana stood. I want to see your protocols for elderly patients. I want statistics on wait times by age. And I want to talk to George Fletcher's family. Over the next hour, Diana stayed at the hospital. She sat with George's daughter when she arrived, terrified and crying. She reviewed hospital statistics that Margaret reluctantly provided, showing elderly patients consistently waited longer for care than younger patients with identical symptoms. She spoke to other elderly patients in the waiting room, hearing story after story of being dismissed, being told they were just old, being made to feel like they were inconvenient for daring to need medical care. When she finally left, she made several calls, first to Emma Bradford at The Guardian, then to Age UK, then to a medical ethics lawyer she knew. "I want to know if this is just one hospital or if it's systemic," she told Emma, "and I want to know what we can do about it." The article ran 3 days later. Diana spoke about witnessing George's near death, about the 12-hour wait, about staff assumptions that elderly patients exaggerated symptoms. She talked about the statistics showing elderly patients consistently received slower care for the same conditions. The response was immediate. Other elderly patients came forward with similar stories. Families who'd lost loved ones wondered if ageism in emergency departments had contributed to deaths. St. Mary's launched an investigation. They found that George was one of many elderly patients who'd experienced delayed care. The reasons were complex: unconscious bias, resource pressure, assumptions about elderly patients' reliability, but the outcome was clear. Age-based discrimination was happening in emergency departments across the NHS. Diana didn't let it rest. She organized meetings with NHS administrators, patient advocacy groups, and elderly patients themselves. She wanted everyone in the room, forced to see each other as human beings rather than statistics or problems. "You're working with limited resources," she acknowledged to the medical staff. "I understand that. But that doesn't excuse dismissing an entire age group as unreliable. If you can't tell the difference between exaggeration and a heart attack, the problem isn't the patient, it's your assessment process." Changes came slowly: training programs about unconscious age bias, new protocols requiring regular reassessment of all waiting patients regardless of age, patient advocates in emergency rooms to ensure no one was overlooked. Most importantly, a cultural shift began. Medical journals published studies on ageism in emergency care. Medical schools updated curricula. The assumption that elderly patients exaggerated symptoms began to be challenged as the dangerous prejudice it was. 6 weeks after his heart attack, George Fletcher met with Diana at a quiet cafe. He'd survived, though with permanent heart damage that earlier treatment might have prevented. "They told me I was lucky you were there," George said. "If you hadn't pushed them to examine me—" "You were lucky I'm stubborn," Diana replied. "But you shouldn't have needed luck. You should have received care based on your symptoms, not your age." George stirred his tea slowly. "I've been thinking about all the times I've been to doctors over the years. How often they've told me things are just part of aging. How often I've been made to feel like I was being a nuisance for having health problems. That's what I want to change. The idea that getting old means your pain doesn't matter, your symptoms aren't real, your life is less valuable. Do you think it'll work? Real change?" "I think what happened to you opened eyes. Sometimes it takes one story, one person, to make people see what they've been trained to ignore." George became an advocate himself, speaking at medical conferences about his experience, helping train emergency staff to recognize their own biases. He partnered with Age UK to create materials about elderly patients' rights in emergency situations. The changes weren't perfect. Ageism in healthcare didn't disappear, but emergency departments across Britain began measuring wait times by age, flagging disparities, holding staff accountable for bias. Diana kept a photograph from that day. Someone had taken it, showing her sitting beside George in the waiting room, leaning forward to hear him better, clearly engaged and concerned while staff moved past in the background. "This picture," she'd tell people, "shows what I saw that day. Not an exaggerating elderly patient wasting resources, a human being in pain, being ignored because of prejudices about age. Once you see someone as human rather than a demographic, you can't unsee it." Years later, medical ethics courses would use George's case study. What went wrong? At what point did age bias override clinical judgment? How could systemic factors, resource pressure, staff fatigue, cultural assumptions, combine to create deadly negligence? Julia Sanders, the nurse, gave an interview where she admitted, "I looked at an 81-year-old man complaining of chest pain, and my immediate thought was another anxious elderly patient. I didn't examine him. I didn't reassess him. I made assumptions based on age, and those assumptions nearly killed him. Princess Diana forced me to see him as a person rather than a category. That changed how I practiced nursing. Dr. Reynolds, the doctor, was less forthcoming publicly but quietly became an advocate for elderly patient rights within the medical system. He developed assessment protocols that specifically countered age bias, training programs for junior doctors about the dangers of assumptions. Margaret Foster, the administrator, implemented system-wide changes at St. Mary's that other hospitals began adopting. Mandatory reassessment windows, patient advocates, age bias training for all staff. For George's daughter, who'd sent her father to the hospital trusting he'd be cared for, Diana's intervention meant her father was still alive to meet his great-grandchildren. "She saved my dad's life," she said. But more than that, she made the system see that elderly lives are worth saving. Diana continued working on healthcare access issues, but the emergency room incident remained one of her most impactful interventions. It exposed a truth many people didn't want to acknowledge, that age discrimination existed in healthcare, that elderly patients were often dismissed and devalued, that assumptions about exaggeration could be deadly. The waiting room at St. Mary's eventually got a small plaque. "Every Patient Matters, June 1996. It was placed near where George had sat for 12 hours, a reminder that vigilance against bias required constant attention. George lived another 7 years, long enough to see real changes in how emergency departments treated elderly patients. Before he died, he wrote Diana a letter thanking her not just for saving his life, but for making his suffering visible to people who'd been trained to overlook it. "You sat beside me when everyone else walked past," he wrote. "You asked when everyone else assumed. You insisted I mattered when the system suggested I didn't. That's what changed things. Not policy or protocol, but someone with influence refusing to accept that age-based negligence was acceptable." Diana kept that letter, another reminder of why using privilege to defend the vulnerable mattered. She hadn't performed any medical heroics that day. She'd simply refused to accept that an elderly man's pain was less important than a younger person's. She'd questioned assumptions rather than accepting them. And sometimes that refusal to accept injustice, that willingness to ask, "Why is this happening?" when everyone else stayed silent, was exactly what changed systems that had been treating discrimination as normal for far too long.